Is it my back or is it my hip? That's one of the most common questions that we get in my office, and it's oftentimes a difficult dilemma, and sometimes it's not so straightforward to figure out if your patient's symptoms are coming from true back or spinal pathology, or if the problem's coming from the patient's hip or hip joint. It's one of my favorite games that I end up playing with some of my partners. Is it my back or is it my hip? And sometimes it's not super straightforward, but there can be some clues to help us figure out what is causing your symptoms. First involves physical examination and also listening to the patient's symptoms. If when we rotate a patient's leg that reproduces significant pain in the patient's groin, that leads us to think that it may be more of a hip problem with actual ball and socket joint. However, if patients have more pain in the back of their hip that can radiate all the way down their leg, that makes us think that it may be more coming from the back. After careful evaluation of the patient's x-rays, or sometimes even an MRI, as well as based on the physical exam, sometimes we can help differentiate between what is the back and what is the hip, and sometimes this requires a steroid injection. For patients that have back problems on x-ray and hip problems on x-ray, a steroid injection can help us differentiate. If you get a back injection, for example, at L4-5, where we see some pinched nerves at L4-5, and that alleviates your hip pain, that may make us a little more likely to suspect that your hip problem is actually coming from your back. So if you think that your hip problem has not been treated adequately for years, it may be worth looking into your back to see if potentially that could be complicating things. For more information about this, check out my website or come see me in the office and we'll try and figure you out.